Hi, this is Dr. Rob Lipkowitz coming to you from my home in Beverly with this week's Rob's Reminder on what to do if you suffer from a chronically dry mouth. If your dental health goals include making sure that your breath is always fresh and that your teeth and smile remain healthy, then knowing what to do if you suffer from a chronically dry mouth should be top on your list. We have a saying in my office, spit happens, but the truth is that's not always the case. Dry mouth is caused by many things, but most commonly it's a side effect of over-the-counter as well as prescription medications. It can also be caused by chronic medical conditions like diabetes, as well as radiation treatment and autoimmune diseases. Tobacco, alcohol, recreational drug use, and caffeine use are also contributing factors. Generally, saliva production will reduce as we age, so dry mouth is a common complaint of older adults. Saliva is the lubricant in your mouth, and solving dry mouth problems is done by increasing saliva or replacing it. Did you know that healthy salivary glands will produce 3 pints of saliva per day? And saliva contains substances that protect your teeth from tooth decay as well as periodontal disease. It's also important in aiding chewing, swallowing, digesting your food, tasting your food, and preventing bad breath. There are many strategies to increase saliva production and treat dry mouth. First and foremost is making sure that you're drinking at least 6 to 8 glasses of water per day. Then you want to limit the amount of acidic and sugary foods and beverages in your diet. Replacing them with crunchy fibrous foods like apples, carrots, and celery will not only hydrate you, but because they're fibrous, they tend to push the plaque and bacteria off of your teeth and make them less likely to get cavities. Sucking on tart sucking candies sweetened with xylitol will also increase your salivary flow without damaging your teeth. You can also explore saliva replacements and mouthwashes designed specifically to reduce dryness, like Biotine. In severe cases, you can have your doctor prescribe pilocarpine. This is a medication which will increase salivary flow. But for a complete list of things that you can do, please refer to my blog at lipkowitzdental@comcast.net. If you have found this video useful, please share it with your friends. Next week's Rob's Reminder will be on worn teeth and what you can do about them. Thank you for watching today, and I hope to see your smiles soon.